Welcome to Conversations. My name is Jason Plotkin, and I am the Program Director at Congregation Emanu here in Houston, Texas. On select Wednesdays, we sit down with a member of the congregation, the community, or perhaps even from the sports world to discuss the current state of affairs. If there's one thing about our community, it is that we step up in a time of need to help our congregants or the community at large. One of the ways that we have helped out when called upon is giving blood and helping our local blood centers. A few years back, those who are watching are probably familiar that our own beloved Rabbi Roy Walter was going through treatment for cancer, and our community heeded the call and provided blood through the MD Anderson Blood Center. This week, we're going to learn a bit more about the MD Anderson Blood Center with our special guest, Pamela Valdes Velasco. So Pam, come on the air if you don't mind. How are you doing today?
Good. Thank you so much for having me, Jason. I'm delighted to be here.
Well, we are so happy to have you on, I should say, and special shout out to our friend Shelly for passing you along and getting you on our radar. So before we cover a wide range of subject areas, I always like to gain insight into our guests and what it is they do. So can you give us a bit about what your role is there at MD Anderson?
Sure. Yeah, Jason. So my main role at the donor center here is to ensure that we have an adequate amount of blood supply for our patients at MD Anderson. So we do this in a variety of ways. My main way that we go about doing it is educating the public on the importance of blood donations. I actually work with a group of other 6 dynamic characters in order to help coordinate blood drives and just getting people through the door in order to donate. As you're aware, I'm sure that it is a unique sell for us because we're not asking for money or something tangible. Rather, it's a purely altruistic action of saving a life.
All right. Well, I love that you called your staff dynamic. I think they'll appreciate seeing that you said that. So many of our viewers have been treated at MD Anderson or know someone who has gone through treatment at MD Anderson. Tell us a bit specifically about the role that MD Anderson Blood Donor Center plays here in the Houston area. What it is exactly that MD Anderson Blood Center does to impact the patients of MD Anderson.
Right. So MD Anderson is one of, if not one of the largest transfusing hospitals in the United States. So we actually service our own patients here. So every donation that you guys give us stays within our hospital. Around 16,000 of our patients actually will receive a blood transfusion each year, which means that about an average of around 150,000 units will be used every year, which is why blood donations are so important for our patients, because like I said, it does go directly to them.
Got it. So, let's start prior to COVID, if you will. We've certainly hosted blood drives here at the congregation. For those maybe not familiar, tell us a bit about the blood collection efforts that existed prior to COVID and perhaps how, people would learn about those collection efforts.
Yeah, so before the pandemic, we were averaging around 700 blood collection units or blood collection drives each year. Around 30% of that would come from high schools and high school students. I would say around 25 would come from churches and synagogues, and the rest would be coming from our other community partners or corporate sponsors. Now, since schools are mostly online and the rest of the community is also online, we did experience around a 30% decrease in our overall blood collections, which did impact us severely. While we did have less patients coming in for treatment at the hospital, there was still a huge demand for blood, which we had to completely rework the way we went around about recruiting. So it did impact not only us, but our patients.
All right, we'll get to the recruiting question in a bit. I'm as you and I talked before, I'm into the PR side, so I'm really interested into promoting things, and we'll get to that a little later. But now COVID, I think COVID and its impact on institutions varied. Obviously, MD Anderson Blood Donor Center is connected to a hospital in the Texas Medical Center, as you alluded to. When did you guys start to realize that COVID was going to come into play and impact your operations? You mentioned about 700 donor events throughout the year. You know, that's 2 a day, pretty much 2 to 3 a day. I mean, when did you guys start to realize that, all right, we're going to have to stop that or pull back and adjust our operations?
Right. So we noticed right away, I believe it was around late March or early April when school started to close down and all the entire pandemic really got on the news. And then our corporate sponsors or corporate partners were next. So we had to start looking at different areas where we could go into the community without putting ourselves at risk and our donors at risk. So we just had to completely rework all of our strategies. And we actually focused into our own employees at MD Anderson, since there were still people obviously working at the hospital. So we had to really rely on our own in order to pull us out in that month or in those couple of weeks.
Wow, that's fascinating. And that really does make sense. I mean, those people, you think of the web, those people
Right.
are the tightest to your inner circle. So like we said, I'm a logistics PR guy, and certainly week to week I ask questions of what has changed and adjusted due to COVID. And I think, a few months back, I had someone from the airline industry who was telling us what it's like to fly. I think we were all accustomed to flying. In similar vein, to some degree, we're all used to giving blood. But if I were to go give blood today, in this COVID state of affairs, what would my experience be like? I'm sure there's someone watching who's a little anxious about giving blood. Obviously, people are doing different things, restaurants, no restaurants, that kind of thing. What's the experience like, and what have you guys done to create a comfort level for those people out in the community?
Right, so it's a completely valid concern. I know people are still quarantining and all of that, so I completely understand where their fear is coming from. But since the beginning of the pandemic, MD Anderson has really gone above and beyond to kind of put those people at just to not have many concerns. Blood donation is different, as you may know. I mean, it's a very close interaction. So at any of our donor centers, we actually provide masks. We ask several questions pertaining to the CDC guidelines before we allow anyone into our building. We are also wiping down all of our beds. We're using different type of antibacterial wipes now, which have been approved. And we also wipe down all of our waiting areas. Like I said, our iPads, all the pens, everything's wiped down. All of our own staff members wear masks. We issue everyone that walks in a mask. So we're taking very cautious actions in everything that we do here. And we are actually also asking that everyone make an appointment online, because that really does help our own staffing and just to make sure that we keep everyone at a safe distance.
I was literally going to interrupt you and ask what happens as it relates to doing an appointment. I mean, I presume that you guys are trying to keep few people in a specific area as possible, as we all are. So real quick, where would someone, and this kind of parlays into my follow-up question, you mentioned earlier that a significant portion were churches and synagogues like ours. You mentioned specifically that schools were a big portion as well. What does that look like now as far as MD Anderson going into the community? Are you guys going into the community with your 700 events? I mean, are we talking maybe this year will be just 100? What does that look like?
Right. So obviously we can't do as much as we had been doing, but we are back into the community now. Like I said, we are all wearing masks. We will, before we let anyone onto our donor coach, we actually make them do all the questions as if they were in our donor center. So we're doing the same thing. And we're actually on the donor bus, we do every other bed. And even within our donor center, we're doing the 6 feet apart, the beds facing away from each other. So we don't want to make people feel uncomfortable in any way. So we actually, all the donors are still there, and we want to make it as available for them as possible. So we actually now are using our MD Anderson Houston area locations. which means that we're out in Katy, which is also called West Houston, League City, Sugarland, the Woodlands. So we're actually doing more consistent blood drives at our Houston area locations. So
Very
that
nice.
helps us.
I think that that's great. And as far as synagogues, schools, I'm presuming not as many, correct?
No, unfortunately, I mean, schools and a lot of synagogues are doing their services online now, but I mean, we're trying to put out our services as much as we can.
All right. Just kind of shifting gears, I guess early on in COVID and maybe less so now since all we're hearing about is vaccines, we heard a lot about antibodies and antibody testing. One of the questions that what I have is there an added benefit now to giving blood during COVID, such as finding out if we had COVID and we were asymptomatic and having antibodies? Is that something that you guys are testing the blood for?
Yeah, we actually started late last year. So for every completed blood donation, we do provide that COVID-19 antibody screening. And it usually takes around a week for you to get your results back. And we're actually also doing a convalescent plasma program here at MD Anderson. So if you do show up positive with those antibodies, you can donate plasma, which goes to suffering COVID patients at our hospital. So it's just another added bonus. You're also eligible for that program if you have your own swab test that tested positive. So we are accepting all of those donors.
Well, it's very helpful to know. And if someone wants to give blood and get the added benefit of finding out if they ever had COVID, that's certainly one way to do it. The other question I have is, I always feel it's important to ask our guests, what is going to remain the same? I feel that we've all learned new tricks during COVID. Certainly you guys are adjusting to not being able to go out into the field in the same ways. And we've all put in place new standards, as you mentioned. Are there things that you think that your MD Anderson Blood Center will have done now that are going to remain going forward as we perceive into this, whatever the new normal may be?
Yeah. So I think we're going to keep most of it. It's really opened our eyes, and we've had to readjust to see how we can allocate our resources appropriately. But mostly the sanitary aspect. I mean, we've always been very clean around here, but we've actually, like I said before, we've adapted with new sanitary wipes and new methods of doing things. So we'll probably keep that. We will definitely keep our mask regulations here at the hospital for a while, and just continuing to work with the COVID guidelines that the hospital issues for everyone. I think that the whole scheduling has really helped us just to make it easier for our donors, to make it more convenient for them so they're not waiting in line or outside, or we just want to make it easy for our donors. And we're actually getting a new computer system here, which means that you'll be able to do your online questionnaire before you come in, which will probably save everyone around 15 to 20 minutes rather than sitting there and doing it on the iPad each time. So we're also looking at
people are not touching the iPad as frequently.
Right, absolutely.
And you brought up something interesting that has come up a few times when we've had these conversations, is that people are turning more to technology and convenience. Right. I think, as consumers, we are loving the convenience of, even though things existed like curbside pickup,
right,
and filling out things ahead of time. So kudos to MD Anderson Blood Center for also adjusting and improving the convenience factor. I think, speaking as a consumer, we appreciate any and all people that are doing that right now. So putting on my communications hat, one thing that I've always wondered, and you're probably at the heart of these kind of conversations, is what triggers an urgent call out for the need of blood in Houston, and how do blood centers communicate that out to the population, knowing that it takes a while to get a message out and for people to respond? I presume there's indications when something like this needs to occur. You mentioned earlier you're down 30%, so that's pretty significant. But in traditional times, I guess, what leads to such a call out?
Right. So generally speaking, all blood centers have PARs. But when we get to the close to the minimum, we have to think about how we're going to relay that message of the urgent need. So the main thing that we like to do is just advocating and educating people on why we need that blood. And we like to put a face on your blood donation. So like whenever we say that it saves 3 lives, we like to connect it to one of our patients here because it is technically going specifically to them. And we do rely on a lot of social media, TV media. We're so thankful for people like you, Jason, that give us this opportunity to kind of just advocate for the need for blood and just educate people on it. Our corporate sponsors have also been very vocal about the need. And yeah, I mean, we have to rely on you guys to help us spread that word.
Well, I appreciate that. And certainly, like I said, I want people to know what it's like, what the experience is like, and how it's changed, so they have that comfort level. Continuing, you mentioned telling a story, relating faces to the gift of blood, if you will. One of the things I like to ask our guests from time to time is some positive story. I think there's these little stories during COVID times that have occurred that really make a world of difference in what it is we're doing as professionals and the work that ultimately, in this case, really saves lives. So is there something that really resonates with you, an experience that you've had, or a story that you've personally witnessed that would really resonate with those watching today?
Right. So my job has also completely changed. At first, I was just a recruiter, but now I'm actually on the convalescent plasma program, which I would have never imagined that we would have to, be recruiting that specific type of plasma. But really, I've just seen the dedication and commitment of our collection teams here. I mean, every day that people come into work, we either have a new training, a new guideline that we have to abide by. So our staff has just really stepped up, and our team has come together for the benefit of serving our patients. So that one mission of MD Anderson has really just put us together, and people just have adapted. I mean, we've had to change the scheduling multiple times, and it's just been very heartwarming and eye-opening to see people adapt so fast, to this constantly changing world that we're living in right now.
Yeah, I certainly give kudos to anyone who has had to adapt, maybe put on new hats or wear multiple hats, which I think a lot of people do anyway. But it's all about adaptability and flexibility. And of course, as David Tanner, who's on with us, can tell you, it's also about adjusting to new technology, which you also mentioned.
Yeah. I'm sure it has been.
Yeah. So my last question is this. I always like to give our guests an opportunity to tell us where we can learn more, where in your case we can register to donate blood. What are the best ways to find what's going on with MD Anderson Blood Center so that we can share that? And for those watching, we will push this with the Facebook and YouTube versions of this that we're providing. So if you need that information, you'll certainly be able to click on that.
Yeah, Jason. So the easiest way is just to go directly onto our website, because we are encouraging everyone to have an appointment before coming on over. It's www.mdandersonbloodbank.org, all one word. And we are in the community, as you said. We like to focus on our 4 Houston area locations. We're out in West Katy, League City, the Woodlands, and actually at Holly Hall. So we're just wanting to make it very convenient for our donors. I would say the easiest location within the loop is to come to our Holly Hall location. It is a single standing building. We have free parking right in front. It is just very convenient.
And real quick, how early does one need to book an appointment? Because I'm guessing that's a question that's going to come up. Can I get a same day appointment? How does that work? Just out of curiosity for those who are watching this and might be encouraged to go to the blood bank that same day.
Yeah, so we ask at least for a day ahead, but if you are just happen to be available that same day, you can also call us and we can definitely work you in. We don't want to deny any donors. So if you find yourself having an extra hour or two, just come on by. And we have a lot of snacks, and we're actually doing a lot of giveaways right now. So that's an added bonus.
There you go. No, you're not going to find a lot of people who turn down swag and snacks. So,
Yeah.
especially my 5-year-old, though he's not old enough yet to to give blood, but certainly would cheer me on.
One day.
So, Pam, I want to thank you for coming on. I really think this was a beneficial experience for those watching, and hopefully you'll get some new blood donors from watching this. So, thank you.
Thank you, Jason. We're so thankful for people like you and just helping us put out the word.
Well, again, I appreciate that. For those watching, obviously, we thank Pam. We also like to thank David Tanner, who's behind the scenes doing the technological work to make this happen. Obviously, Conversations airs 12 on Wednesdays, select Wednesdays, and we're working on some future guests. We've had some great guests. We've got more things in the work, and we'll be announcing those shortly. And of course, as a reminder, you can always catch any episodes you've missed on the Emanu YouTube channel. We've recorded over 30 of these with great guests, ranging from nonprofits to elected officials to sports people and more. So make sure you check that out. And of course, thanks for joining us, and we will see you next time on Conversations. Have a good one, everybody.